Hi, Howard Brown community. Thank you for joining us. As we reflect on 2020, I invite you to access your memory bank. Where were you at the start of the pandemic crisis that has so dramatically affected all of our lives? More precisely, where were you exactly 1 year ago on March 11, 2020? To refresh your memory, on this very day, a year ago, state officials confirmed 6 new cases of coronavirus, pushing the statewide total then to 25. That week, news reported that a worker in the Prudential Tower had tested positive for coronavirus, causing alarm across downtown offices. Nationally, authorities reported more than 1,000 COVID-19 cases and 35 fatalities. As a result, President Trump restricted travel from Europe to the US. A year ago this week, Tom Hanks and his wife, Rita Wilson, announced to the world that they had tested positive for the virus. I remember March 11th vividly because on that very day, Howard Brown reached the difficult decision to postpone DISH, our inaugural dinner program and fundraiser. It had been originally scheduled for the next day, March 12th, at the Allegro Hotel. I remember furiously rehearsing my remarks. I'm sorry you did not get to hear them. Our table captains were reconfirming their guests, and our staff were working hard on last-minute details, preparing for our 400 expected attendees. Unfortunately, the postponed event has yet to occur. And in the ensuing days and months, Howard Brown faced historic challenges. Under the statewide shelter-at-home order, we worked with patients to delay non-urgent medical appointments, reducing in-person visits by more than 80%. We scrambled to procure enough personal protective equipment for our workforce and directed nearly 300 employees to work from home. With support from public and private insurers, we launched telehealth and began offering behavioral health, medical care, insurance navigation, PrEP assistance, and gender-affirming care and support services via video and telephone visits. To reduce the risk of contagion, we assigned staff at the front door of all of our clinics to screen visitors for risk factors such as recent international travel and flu-like symptoms. As early as March 14, 2020, we administered our first coronavirus test and set up tents next to our clinics to house open-air community care stations for COVID screening and related medical attention. We had to revise our employee health protocols to encourage sick employees to isolate and self-quarantine. We also scavenged our supply closets and vendors for various size swabs needed for COVID and other diagnostic procedures. In the early months of the pandemic, the nationwide shortage forced us to limit COVID testing to a few dozen tests per day. Always up for a challenge, the pandemic forced our teams to get creative. We brokered an agreement with Project Vita and Task Force Prevention Community Services, 2 important HIV prevention organizations, to bring COVID testing stations to their West Side locations. Thanks to our early work in the Little Village and Austin neighborhoods, we helped document a previously unrecognized epidemic of COVID in those areas, which is home to many essential and factory workers in industries that had been slow to supply personal protective equipment. At Project Vita last spring, 6 in 10 of all individuals screened were positive for COVID, a staggeringly high level of disease prevalence. Crowded living conditions and fears of anti-immigration policy made it even harder to reach those who needed our help the most. Recognizing the barriers some communities face, Howard Brown partnered with Mobile Care Chicago to take COVID screening directly to residents at Southside and Westside shelters, recovery homes, and long-term care facilities. Our patients with severe persistent mental illness received support from Howard Brown and our partners at Thresholds, who administered injectable treatments from our mobile van, helping patients shelter at home. We launched what might be one of the first HIV prevention programs tailored for the pandemic, delivering hundreds of safer sex supplies and at-home testing kits to patients sheltering at home. By May of 2020, Howard Brown's contact tracing workforce had already reached nearly 1,000 individuals about their possible exposure to coronavirus. Howard Brown has a long history of providing contact tracing for people recently diagnosed with HIV or another sexually transmitted infection. Our team mobilized quickly to extend their services to help people with COVID identify and inform their contacts. Patients with COVID also disclosed to our staff the depth of economic hardship they were experiencing. As a result, Howard Brown leveraged grants to bolster our rental, utility, and food assistance programs. We launched a hotline for patients to direct their COVID-related questions to an informed medical provider. In the spring, the hotline logged as many as 60 calls per hour. Each innovation motivated staff to work harder and smarter to stay ahead of the pandemic. But our efforts were not without sorrow. We diagnosed 9,000 patients with COVID, cared for hundreds of people with symptoms, and attended to dozens of patients who required intensive hospital care. And COVID claimed the lives of friends, parents, uncles, aunts, grandparents, and other relatives. And the tragedies were eerily familiar to so many of us who survived the early days of the AIDS pandemic. The collective fear, stigma, and inequalities reminded us of our own sense of helplessness and loss in the darkest days of the AIDS pandemic. Indeed, Howard Brown's 3 decades experience fighting HIV emboldened us to fight coronavirus as swiftly and decisively as possible. It was as if we were granted a cosmic redo, a second chance to bring to bear all the innovations and all the determination society lacked when HIV hit our communities in the early 1980s and 90s. There are so many important lessons learned in HIV that we applied to the current pandemic, the most profound being the power of community mobilization. All the public health experts in the world cannot affect change without engendering community trust. That's why we developed strategies by listening to partners such as Project Vita and Task Force and talking to people living with COVID about their needs and concerns. This, more than anything, made a profound difference. And we believe the results bear that out. 64,000 COVID tests administered, 9,000 people diagnosed with the illness. The vast majority of our tests administered were in hard-hit South Side and West Side communities. Howard Brown administered 3% of all COVID tests performed in Chicago in 2020. We logged 38,000 telehealth appointments. More than 1,000 patients received food box and other forms of food assistance. To help young people experiencing homelessness, we provided more than 200 smartphones and 50 tablets to help our patients connect with their care teams and continue their GED tutoring without interruption. Howard Brown provided more than $2 million in emergency financial assistance for patients struggling to pay rent, utilities, and food. In the midst of all of our pandemic responses, Howard Brown sustained a broad set of community health offerings. For example, with generous support from the Illinois Children's Healthcare Foundation, we were able to renovate our dental clinic in Englewood to accommodate a new children's waiting room and new pediatric operatories needed to fulfill an agreement brokered in 2019 with Chicago Public Schools to serve as their dental provider for Southside students. I'm sitting in the dental suite right now, and we're so excited for you to see it. Our Center for Education Research and Advocacy worked with dynamic leaders representing transgender women of color communities in Chicago, LA, Washington, D.C., and Houston to develop a nationally representative plan for health research to improve the lives of trans women of color. The plan they developed addresses ongoing concerns of high levels of community violence. The plan also elevates the need for interventions to improve vocational training and options for women to earn a living wage. It highlights the need for better health care and better behavioral health options for the community, as well as a greater set of research findings into the long-term effects of hormone replacement therapy. This community participatory research plan will help us pursue additional research funding in each of these important areas moving forward. In 2020, we also maximized technology to move many of our in-person meetings to safer virtual environments. For example, the Midwest LGBT Health Symposium successfully moved the conference online and educated more than 400 participants over 2 days. We held our first ever virtual Big Orange Ball. The Halloween extravaganza continued without a hitch and entertained hundreds of loyal patrons with drag and burlesque performances, ghost stories, and other creative content. Our health education teams took over Facebook and with engaging panels and discussions on everything from the census to ways to support Black Lives Matter and the national reckoning around racism and police abuse of power. With equity, anti-racism, and LGBTQ visibility and inclusion as our North Stars, Howard Brown continued to pioneer new ways to advance community health across our city. Our efforts would not have been possible without the leadership of our dynamic staff, who work tirelessly to serve the community. A heartfelt thanks to everyone, including our hardworking teams at the Brown Elephant resale stores. When the stores closed in the spring due to the pandemic, staff leapt into action, supporting other community initiatives. They and everyone else were amazing, and we extend to them all of our love. Our community advisory boards, the Vernita Gray Auxiliary Board, and the Howard Brown Board of Directors also deserve ample applause for helping support our many diverse initiatives in 2020. Finally, a huge thanks to each of you, our partners, community supporters, donors, and allies. We could not mount all of our services without your generous help and support. A huge thanks to our gold level sponsors helping support our program this evening. Advocate, Illinois Masonic Medical Center, and Walgreens. Thank you so much.
Hi, welcome to Howard Brown. I'm just going to ask you a couple of safety COVID questions. Have you been outside of the United States in the last 7 to 14 days? Have you been exposed to anyone with the COVID-19? Perfect. Follow me this way.
Need hand sanitizer? Welcome to Howard Brown. Registration is right that way. Oh, hey, let me adjust your mask for you.
Who is it? 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 It's me. Who is it?
Kissed by the rose on the grave. I've been kissed by the rose. If I should kiss by the rose, I've been kissed by the rose.
Stuff for you, but what has he done for you lately?
So much better, I'm for you. I gotta hear me. So much better, I'm for you. So much better, I'm for you. Sing my songs, striking my God, not good for my body. I change it up, you know. So much better, I'm for you. You gotta get up off that great. And I guarantee they'll fall in line. So much better, so much better. I'm for you.
3, 2, 1. We'll go slow and high tempo, light and dark. Hold me hard and mellow. I'm seeing the pain, seeing the pleasure. Nobody but you, body but me, body but us, bodies together. Where you going? I'm with you.
Wind up, oh, wind up, oh, wind up, oh yeah.
Yeah, I can't get enough of you. Bottles open up so you can try and open up for me, baby.
Wind up, oh, wind up, oh, wind up.
MIA, you do you, girl. The haters go ahead, cut them off like you a sensei, girl. I know
hit that footwork like.
Hi, I'm Shannon Lynn Parker, Director of Strategic Partnerships at Howard Brown Health. For the 35,000 individuals who come through our door, whether they are seeking primary care, dentistry, gender-affirming services, or more, they can rest assured that whatever they are here for, providing good affirming services will be at the helm of what we do. We at Howard Brown Health not only believe but know that good affirming healthcare is not just a privilege for the few, but a right for the many. Zach received confirmation of a COVID-19 infection at Howard Brown in March of 2020 after feeling ill. He was hospitalized and dealt with severe COVID-19 symptoms while living alone.
Ya llegué a la Jules, estaba lleno de gente. Y claro, yo sin cubreboca, porque yo no sabía, mucha gente sin cubreboca el 2 de marzo del 2020 y la tienda estaba lleno y yo fui a comprar jabón, papel de baño, un poco de comida, pero yo no encontré nada para la limpieza, ya no había nada de eso, y la línea estaban hasta allá, ya más me vine a la casa. Estaba bien ese día. El día siguiente, después pasaron como 2 días y ya empezó a dar como fiebre, que estaba cansado, el dolor de cabeza, tos muy fuerte, pero era un tos que era horrible, en mi vida nunca lo había tenido, Yo vivo aquí solo en Chicago, entonces tengo solo mi estudio, mis cosas, pago mi renta. Si no pago mi renta cada mes voy a ir a estar abajo de un árbol o abajo de un puente porque yo tengo que pagar mis biles cada mes, Después de eso, de que la Abby me dijo qué es lo que tengo, entonces me regresé, me hizo el text, después regresé, me recetó unas pastillas que regresara en la casa, y se estaba haciendo peor, y estaba en la casa descansando nomás, ya ni comía, ni cocinaba, nada más estaba ahí en mi sofá, pero claro, los biles llegan, de mi electricidad, de mi renta, de mi teléfono, y esos llegan cada mes. Entonces lo que me acuerdo, me preocupé más fue una vez que llegó un bill de mi teléfono, entonces hice el cheque, mandarlo, vivo en el 4º piso, lo llevé abajo en el lobby para mandarlo, y ya estaba con el tos bien feo, y hice el bill, lo llevé, ya empezó a salir a caminar y empieza el tos a subir, a ser feo, y el fiebre está ahí, dolor de cabeza. Entonces nada más estaba como rezando que puedo llegar abajo y regresar a mi casa, y aunque esté tosiendo, pero estoy dentro de mi casa, dije yo. Entonces no quería usar el elevador, usé las escaleras, entonces ya puse eso, me vengo de regreso a mi apartamento y empiezo a toser más fuerte. Entonces son 4 pisos. Apenas llegué en el pasillo, ya de ahí como que se hizo todo negro, y tenía vergüenza que la gente de ahí en el hallway me estaba viendo, que me vieran, y quería abrir la puerta y aventarme en el piso, no sé, y ahí otra vez las cosas que pasan en mi cabeza, qué pasara si esto ya es el fin, o como no tengo nada hecho todavía, ya llegué y no podía respirar, nada, no podía, y entonces llamé a la doctora Abby, y dijo sí, vente aquí a la clínica, ahorita mismo, dice, ya llegué en el Halstead, entonces llegué, me checó lo más rápido que uso es que me puso el oxígeno, que ya no tenía oxígeno cuando llegué, y no tengo oxígeno en mi casa tampoco. Entonces me dijo, tenemos que mandarte al hospital. Entonces llamó a la ambulancia y fui al hospital. Y cuando llegué allí, lo primero que me pusieron medicina, y los pompis, y el oxígeno, porque me dice un doctor que vino, o nurse, dice, tus pulmones están totalmente destruidos, qué bueno que hiciste la decisión de venir, y si no hubieras venido creo que no estuvieras aquí todavía. Y ahí me cuidaron bien. Creo que si ese día no encontré a Abby, no estuviera aquí, y estuviera más allá. Mucha gente no cree del coronavirus, creen que nada más la gente habla, eso no existe. Yo lo que voy a decir que sí existe, sí hay, y que la gente se cuide, pues, usar cubrebocas, 2 si es posible. Como yo digo, hasta que no te toca, ahí no lo crees, sino ya que te toca, ok, así es.
With the lack of affirming LGBTQ community services on the south side of Chicago, Johnny receives primary care at Howard Brown Health 55th Street, where he has found an accepting community that welcomes him like family.
My mom, she told me that I was almost perfect. It was like, you're black male, your GPA is outstanding, you got 3.5 GPA, you got potential, and then your parents tell you, but because you're gay, you're almost perfect. It was something that I internalized, and it took me a long time to dig myself out of that. It was unfortunate, but it was just like when you're with your family and there's a disagreement about your identity, who you are, and there's nothing you can do about it. You have choices. You can either choose to be something you're not, or you can be yourself, and that was the choice. And that's what my argument was. That's what I told them. I was like, there is no choice in being gay, but there is a choice in choosing to be yourself, and I chose to be myself. So I called her my aunt, Wadini, who recently passed, and so she was one of my I wouldn't say favorite aunts, but she was the one that was most dearest to me because she gave me a backbone. She was the one that gave me the right, or reminded me of my right, of being who I am and being my own best friend. She took me in and she let me stay at her place for a couple of years. I first heard of Howard Brown through word of mouth. This was when I was living on my own, Rogers Park, going to DePaul University. And I heard about it through some of the youth that was at the coffee shops. I never had a doctor that talked to me like I was like in a therapy session. More like he was trying to be a friend. He's trying to know who I was. I seen friends who got HIV, didn't get tested, didn't have the resources. Statistically, there is a large number of people who are HIV positive on the South Side due to the lack of knowledge of what HIV is, due to lack of knowledge of a lot of things. This is very multi-layered in all its issues, but with Howard Brown, it solves the biggest proportion of those issues, which is accessibility to those meds, especially PrEP. And since Howard Brown is providing a program where you can get PrEP for free, and then have a mentor like I do, which is Letitia, who calls me up, and then also giving you a therapy and things like that. If you are high risk, these things is what you need. They say, there's an Afro proverb that says it takes a village to raise a child. It really does. And that's also for people. Howard Brown works in a way of like a village. It creates a center where you are welcome to come. You are welcome to get what you need for your survival, for your medical needs. Nichiren Shu is a Japanese set of Buddhists created by a man named Nichiren Daishonin, who was a 13th century monk. He was a Tendai monk. And so we chant our mantra, which is Namu Myoho Renge Kyo. And so the idea of this practice is basically to just alleviate your suffering, like all Buddhist practices. And so what it means to me is it gave me life. At one point in my life where I didn't have anybody, you know, I was just by myself. And my aunt was trying to reveal to me at the time when she was alive that, you know, your family loves you. I kept having faith in my ancestors and in my family line that there will not be a break between my family and me, basically. It gave me a meaning, it gave me a purpose. It brought me up from a depressive state to an elevated state of knowing that there's possibilities and that my victory is in my own empowerment, not something outside myself. Every time I see people go into Howard Brown, especially the one on 55th, it's like, it's always laughing, it's always smiling, it's always recatching up. And that's why a lot of people go there. A lot of, you know, black gay men go to Howard Brown because of that fulfillment, that love that we get, especially from the receptionists, from the doctors, from the psychiatrists, from all the staff members there. They're very friendly. And they don't make you feel like you're unwanted or unwelcomed, or they don't make you feel like, oh, because you don't have the money, you can't afford these services. So it's really, you know, it's really a good space to be. And that is part of health too, I really believe. You know, once you walk into the door, when you feel like you are, you know, being welcomed, that sets the right momentum into your recovery. And that's what Howard Brown does a really good job at.
Tonight, Howard Brown is excited to bestow the Friend for Life Award on two amazing community activists, Pepe Pena and Art Johnston. Both are dear friends and both are legacies in Chicago. Now, LGBT rights and advances in Chicago, Cook County, and Illinois have 1,000 parents, but really only 2 fathers, and that's Pepe and Art, who have led the way pouring into institutions like Equality Illinois and advocating vigorously over 20 plus years for changes in policy and law to improve the lives and wellness of LGBT Chicagoans. They are pioneers and business owners who have opened the doors of their establishment, Sidetrack, for community events, for fundraisers, for ways to gather the community, all thinking about how to improve our lives. And for that reason, we are so excited to bestow this award and give them this award this evening. Something we've been trying to do for over a year, as this award was originally planned for our dinner program on March 12th last year. So Art and Pepe, I love you, we love you, and we thank you from the bottom of our hearts for all you do to improve the lives of Chicago.
Open to everyone, the first Howard Brown provided testing and treatment by medical personnel.
There was a coffee pot, a portable kitchen table, and a few barely functioning chairs in a small space above a bodega across Lincoln Avenue from the Biograph Theater. I remember that first Howard Brown space, which was born in 1974, barely a year after this man and I had fallen head over heels, crazy in love with each other.
The waiting area was also a great place to meet people. And you knew those people were taking care of themselves, they were health conscious, and they were sexually active. So you could make a date for 2 weeks later when the penicillin was already done its job.
Pep was a popular bartender at a time when bars were not just the only safe spaces for our folks to be themselves, but were the primary builders of community and incubators for activism, raising funds, quarter at a time, toward the dream of a community center and to bail out our friends who were arrested in those still prevalent police raids. Right now, Howard Brown is moving forward with plans for an enormous new location on Alsted and Cornelia, which, in addition to more much-needed program space, will assure that North Halsted remains America's most successful LGBTQ business district.
I want to especially mention the Broadway Youth Center, which does some incredible work with young people who are mostly identified as LGBTQ. The new permanent home for BYC is currently under construction on Irving Park Road. It is thrilling to imagine how much more will be possible in this little space.
Over the years, since opening in 1982, we have tried to make our bar, Sidetrack, a credit to our community, partnering often with Howard Brown to provide insurance and medical care to our staff and through them, spreading the good news about Howard Brown's excellent programs to our customers, especially to those Chicago newbies for whom bars are still often the first introduction to our vibrant community. In association with Equality Illinois and other fair-minded organizations, we have also worked tirelessly to help make the programs and laws of our city, county, and state more supportive, more proud of our LGBTQ communities. Not very long ago, no elected official or candidate would go near a gay bar. Now, around election times, we have to schedule their arrivals so that they don't bump into each other. In our clout-heavy state, hearing the words gay and clout used together is no longer a surprise. Thinking back on that 1974 coffee pot, table, and beat-up chairs, I also remember that the first Howard Brown was abundantly furnished then as now, with dedication, expertise, and hope for the future. We are now in that future, and we have the strength to continue building our community and facing down our enemies. We learned from Howard Brown that to be strong, we must first be healthy. And although our work is far from over, our community is now both healthy and strong and ready for all the challenges to come. Thank you, Howard Brown.
Well, one, he is a strong advocate for our 63rd Street Clinic as well as our community, our patients here. So when an opportunity presented itself for when he saw that there was some patient teaching information that we could truly benefit from that was located elsewhere, but we didn't have it, he brought it to our attention so that we could be able to go through and do what we need to have that available to give to our patients. It told me that he was comfortable in coming to ask us and those of us serving in a leadership capacity what we can do to improve what we're doing. And it gave me kind of like more of an insight on him as a healthcare provider, that he strove for excellence, which is really what we want to do for our patients. They deserve that.
Tyrone, I am deliriously happy for you. I am so excited and I am so proud of you. When I first met you, you were in MA at the Sheridan location, and I was introduced to you and you said, "Hi, I'm Tyrone." I went back looking for you one day and they said, oh, he had gone to school to become a nurse. Made me even more excited. Tyrone, you are a leader, you are a fierce patient advocate, and you are a warrior in the community, and especially with outreach. You are that person that I can go to at any time and you'll say, "I'll do it. Yes, I can. What do you need? I'll change my schedule." And you do it with this smile on your face. Never, ever change your way that you are now. Even more importantly, Tyrone, you believe in and aspire to the goals, the vision, the mission of the organization, and it shows every day, no matter what you do. I believe in you. The world is your oyster, and now you're going back to school to be a nurse practitioner. Fast forward, you'll probably be an NP here at Howard Brown. I believe that. Tyrone, you are an eagle. Continue to soar, continue to be you. Enjoy your life. Medicine is amazing, and you're going to be part of that. Congratulations.
I can really find the words of how to express how it feels to be recognized for something that comes so natural, something that you're so passionate about that really doesn't feel like a job, but just doing what you love. So it's truly amazing, and to have a supportive team behind me, pushing me to be great. Even when I'm not, even at my low moments, they're still pushing me to be great. It's truly a rewarding feeling. One of the barriers that I see to healthcare is there being a mistrust. Patients not feeling comfortable going to doctors that don't look like them, or that they don't perceive will understand their struggle, where they come from, and be able to provide the necessary resources that they need. Additional barriers I feel are, especially from my personal experience and personal experience of people that I've spoken with, is that they feel that their voice isn't being heard. They feel that they're going to a doctor, the doctor is in an authority position, so I know what's best for you, and never taking what they're saying into consideration, like they may not having those funds, or other outside situations that may be preventing them from receiving the care that they need. how I relate to the mission, I guess, continues to go back to me being that bridge of ending the disparities. So that's one of my main goals, why I want to be in community health, specifically with the African American community who face the greatest disparities. So being with an agency that's mission is to eliminate that, I align perfectly with it. Everyone who knows me knows that I would never accept any award or any recognition without first thanking my Lord and Savior who created me for this very moment, as well as giving me all the necessary tools that I need to carry out my purpose, as well as ensuring that my name is brought up at the right time with the right people. Of course, thanking the leadership for always supporting me in all of my crazy ideas whenever I have one. Also want to thank all the other nominees for all the amazing things that they're doing, as well as all the people who weren't nominated but are still silent killers and forces to wreck with. I think this award isn't just for me, it's for everyone here. It's for the team that I work with on a daily basis that continuously push me, especially here at 63rd. We're like, it's weird, you spend most of your time here and this becomes like your family. So this award is for all the moms, dads, cousins, aunts and uncles that I have here. We are like a team, and no matter any challenges that we face, it's amazing how we always come out victorious. So this award is for all of us, and also I want to thank Howard Brown, the real MVP. I'm just here to help.
For the 1,500 youth that the BYC serves, the young people will attest that the services that they receive are not only life-changing, but life-saving as well. Now meet Jordana, who grew up in foster care and found the BYC at a time when she needed it the most.
I believe the first foster home I do remember was in Richton Park. It was with a couple, and I was really young. They took me in with the knowledge that I was temporary in their home and that they would be taking care of me until my mother got her parental rights back to get me back from the foster care system. Yes, 26 foster homes in a matter of 15, 16 years. And the reason why I moved around a lot when I was younger was because of the courts and my mother and location and things like that. As I got a bit older, I believe I've developed some very heavy traumas. And one of the main reasons, which sounds really like messed up, but one of the main reasons why I kept moving was because foster parents didn't want to keep me. Early on, it took a really big emotional, mental toll on me. I felt like I wasn't wanted. I felt as though there was no place for me. For a little bit, I even felt like I was cursed. Like I had everything that I needed and wanted right within my grasp, but I could never quite hold it or hold on to it, or it was never quite right. Foster parents, my identity was disclosed several times before I was placed in a foster home. A lot of times I would be waiting for weeks to find a foster parent because of my identity, because foster parents wouldn't take me in. Some foster parents that did had guidelines around how I expressed myself, what I wasn't allowed to do, be it mannerisms, inflections in my voice, anything like that. There was very heavy policing in some places. In some places, there was more tolerance, very prevalent tolerance. And then in some places, there was just outright rejection. I started stealing clothes from my sister's closet. I would have friends at school. I got caught actually once in school from stealing. We were in gym and one of the young ladies had changed out of her clothing. And you know, I thought that while we were on break or whatever from playing in the gym, that I would sneak off into the girls' locker room and I would go into her locker and swap one of my clothing items for hers. And so after school, what I did was I went into the bathroom and I would do this thing where, I don't remember where I got a bra from, but I would take this bra that I had to school and I would go to the bathroom and I would stuff it with tissue. And I would basically just wear the shirt when like everyone's being dismissed and you know, the bathroom's completely mine. And I would just kind of just like feel it and it felt so natural and felt so good. I believe one time I got bold enough to walk out of the bathroom with the chest, and I had on this leather jacket, honey. And I had on my school pants, which were black, and I just felt my fantasy. And you know, ironically, I walked through the halls and everything let out, like all the classes. And some kids were living. Some of the boys and girls were like, whoa, wow. I don't want to say they were living because they didn't even know what they were seeing. I didn't know what I was seeing, but it was more or less a very positive intrigueness because they'd never seen something like that before. And I was always moving around from home to home, so I always had a fresh school to try something at. I always had a fresh environment to test the waters in. So the BYC staff, some of the first people I met were also people, some of them were folks who had went through the foster care system and experienced homelessness and housing instability. Even at that time, having that experience, even when I was still in the foster care system coming out, it is where my healing really began. My first impression was a culture shock. Because up until that point, I had never seen so many openly queer, trans, two-spirit, like just different people in all the same like space. It was the most diversity I had seen concentrated in one space. And I was like, wow. Oh my gosh, trans people doing their makeup openly in a space. That was happening. I remember that. There was this beautiful trans woman that was sitting in that space. Yeah, I remember her doing her makeup and she was sitting there with a compact and she was just like doing it. And people around her were just living and just affirming her. And I just was like, what the heck is going on? I became emboldened to resist the ways that people were treating me, the things that they were saying to me. I became emboldened to really fight back. And it was because I had got a taste of reality, the good part of reality. And you know, I just knew I had a right to be me after that. So around 17 and a half is when I started to transition from the foster care system, specifically being in residential treatment facilities, to being in independent living within the foster care system, which is more so of like a transitional living situation. And from there, I was emancipated while I was in the Thresholds program into a SRO, which is a single room occupancy transitional space that was in the West Loop of Chicago. Because I knew about the Broadway Youth Center and I knew about its services, I could access that in that period of me needing, you know, stable housing and things like that, because I couldn't stay at the SRO. I had to eventually move. So I stayed there for about a year. And while I was staying there, I was working with the resource advocacy team from the Broadway Youth Center, and they were helping me fill out, you know, like public housing waitlist voucher applications, helping me locate resources for employment. I also was provided with a really great opportunity to be an intern for the Voices team for the Broadway Youth Center, receiving trainings from Howard Brown during that period. So that was very good to put on my resume. One of the resource advocates, Julio, helped me locate a resource that allowed me to push my process through the system a little bit quicker. If I didn't have the help from the Broadway Youth Center, and I didn't have the help of, CHA, La Costa Norte, and these different resources that serve the LGBTQ queer community, I would be homeless. That is, to me, a fact, because with the way that things are set up systemically, I wasn't in no position, fresh out the system, not having, like I said, any of those things like work history. So call it irony, call it alignment, call it, I don't know, anything you want, but where I'm located right now, I'm within walking distance of the Broadway Youth Center, Center on Halsted, and like all of the queer resources that I need as a Black trans woman. And I'm in a safe neighborhood, and I'm right on the lake. It happened 1,000 times smoother because of the assistance and the help that I got. Having my own apartment, having my own space, it feels like a rebirth to me. It feels like I've been reborn in a way where everything that I thought was possible, all the odds that I thought I would not beat, are now possible for me to beat them. And it's a statement. It's not just that I have my own place. It's the location. It's this opportunity. It's telling my story. It's being in my own space and telling my story. And it feels like now I can think bigger, dream bigger, plan bigger, like where I am and the success that I'm experiencing and this period of good fortune that I'm in, it matches me, and it's more than necessarily what I want, it's what I need. It makes me feel like a bad bitch. Having my own space really does, like, it makes me feel so, it's beyond the independence now. It's just simply, it's something I never experienced.
Oh my gosh, I am so glad you guys are open.
Oh my God, I need that couch.
Yeah.
Oh my God, what are these places to be?
I know David the CEO. Let me in here.
Okay, are you ready for this?
Lost track to my side, just vibing. And JB gon' brawl with me. T-double-D, he up an excursion, swerving all on the curb with a virgin. And I'm Trina, you heard my name. I'm still the baddest, ain't a damn thing changed.
I don't wanna hurt you, please, but there's no easy way to speak. Lately, I've been spending time with this other guy. And though you're still the one, he's been getting all my love. But I don't wanna hurt you. I don't wanna love you. But there's no easy way to speak.
See how the booty shake like an earthquake. There is no escape when I shake it in your face. Now don't you wanna tape a booty shaking on your tape? So show it to your boys and see the look on all their face. I move it to the left, move it to the right. Double time, I'm showing what they like. Look at it, slow motion freeze. Stop for the camera, paparazzi wanna see. Cheese. Hello, hey, how you doing? I shake it like this, now let me see if you could do it. Drop it on the one. Shake, their faces all stunned.
What an incredible group of honorees and performances we've had tonight. My name is Mario Tretto Jr., and I'm proud to serve in my 4th and final year as chairperson of the board of directors at Howard Brown Health. I'm here at the National Museum of Mexican Art, one of my favorite locations in the city of Chicago, which now brings me an additional layer of joy as it is one of Howard Brown Health's many COVID testing sites, and as of last month, a COVID vaccination site. Bienvenidos, estoy orgulloso de estar en el Museo Nacional en Pilsen, donde Howard Brown está ubicado, para una colaboración de salud para proteger nuestras familias contra el coronavirus. 4 years ago, I made one of the most rewarding decisions of my life in running for board chair at Howard Brown Health. These 4 years came with many heartfelt and enlightening meetings, conversations, and ideas with fellow board members, Howard Brown Health staff, community partners, and many more. One thing is for certain, the passion exuded by each fueled my calling to serve an organization that impacted my life and personal health since 2012. Board colleagues, thank you for your confidence in me. My experience has been that of a well-functioning board, being supportive and collaborative, and not afraid to challenge the status quo in order to best serve Howard Brown patients. We have done an incredible amount of work and will continue to only build upon the solid foundation laid before us in order to support LGBTQ communities for generations to come. I cannot wait to support Board Chair-elect Chef Fresh Roberson's vision in her upcoming term. To all of Howard Brown's community partners, funders, government representatives, and supporters, your ongoing trust in the work of Howard Brown is appreciated beyond measure. Howard Brown staff, thank you for your work and living the mission of Howard Brown Health on a daily basis. It is your work that makes our vision a reality for our 40,000 patients. It truly takes a rainbow-covered village to do such inspiring work. And finally, a heartfelt thank you to David Ernesto Munar, whose executive leadership has truly elevated Howard Brown well beyond what many thought possible. The thought that 2 gay Latino men would be at the helm of an organization that provides compassionate and critical care services to thousands of our most marginalized siblings was something I had not thought possible as a child. I will miss our many calls, meetings, and Zooms spent discussing anything and everything necessary to ensure Howard Brown continued on its positive path to expanding care throughout the city that I love so much. Thank you for your support and friendship that have made my 4 years as chair so enjoyable. This partnership with the National Museum of Mexican Art and similar partnerships with organizations like Project Vita, Thresholds, Loyola Park, New Beginnings Church of Chicago, Trinity United Church of Christ, Trinity Oaks, Compassion Baptist Church, Los Amantes Banquet Hall, Talia Hall, Rising Sun Church, and Task Force all demonstrate the intentional and responsive ways in which Howard Brown aims to serve all members of its community. I would like to thank each of these partners and the many teams and individuals at Howard Brown who have dedicated the past year to ensure our communities have been cared for throughout the pandemic. We've seen a number of successes this past year. I would like to highlight a few plans that expand our services throughout Chicago's north and south sides. We are currently in the midst of construction of a new and expanded Broadway Youth Center that is designed and dedicated to ensuring LGBTQ youth continue to receive essential health and support services. Opening this summer, this 5-story, 20,000 square foot facility will feature spaces for primary care and behavioral health services, offering as well as the vocational education and drop-in services that the BYC has become so well known and recognized for. Also underway is the construction of a new care site on Halsted and Lakeview. This property at the corner of Halsted and Cornelia will be the new home of the Howard Brown Health Halsted Clinic. This property will double the capacity of the existing Halsted Clinic for primary care services, walk-in sexual and reproductive health care, and also house wraparound behavioral health services. Howard Brown is also the coordinating partner in the development of a new LGBTQ community center and health clinic that will serve our current and future Southside patients and communities. We're proud to collaborate with numerous state partners, nonprofit agencies, and legislators to make this long-awaited dream into a reality. We thank Governor Pritzker's leadership as he signed into law the Rebuild Illinois Infrastructure Bill supporting the Southside Community Center. All of these projects require all hands on deck, and there is a role for every stakeholder to play. Whether it be volunteering your time and talents, providing financial support, attending one of our many fundraisers, engagements, or outreach activities, or joining us as a new patient receiving care at Howard Brown. Visit www.howardbrown.org to find more information on how you can get involved. I look forward to an exciting next chapter for Howard Brown Health. It has been a true pleasure to serve you all as board chair. Thank you and have a wonderful night.
Hello, and thank you so much for joining us for Howard Brown Health's annual meeting for 2021. My name is Brady Jackson, and I joined Howard Brown Health about 6 months ago in the middle of this pandemic. And let me tell you, it's a very interesting time to be transitioning to a new organization. I get a lot of questions about this idea of self-care. It's become a buzzword, and it's hard to know exactly what that means at a time like this. But what I'd say is self-care is all about finding the things, the moments that bring you joy. It can be something as small as lighting up a candle at night that you find beautiful. It can be cooking yourself a meal that you enjoy. It can be picking up the phone and talking to a friend. It can even be sitting quietly in reflection. But it's about intention. And self-care requires intention. As someone who is recovering from doing too much for everybody else, take it from me that self-care is one of the most important investments that you can make in yourself. What I love most about Chicagoans is our resilience, our ability to take a hard situation and make it a positive, make it something good, or at least make something good come from it. I want to encourage each of you to think about your own sphere of influence. Think about where you work, think about your friends, the people you love, and ask the question, what can I do? What can I do to bring us closer to a world where everybody can have access to good health care, where everyone can be treated fairly? These questions sometimes feel bigger than we are, but it's important to realize that you're not alone. Please join Howard Brown Health in fighting for health equity and social justice by speaking it, by saying it, and by taking the concrete actions in your community to fight for change. It isn't pointless, it isn't useless, and there is no action that's too small. Because when we work together and when we all refuse to stop fighting, there is no option but justice. Thanks for joining us.